Good evening. I'm Gracelyn Guyol, and welcome to Restoring Kids' Health Holistically. In this series, we will be addressing solutions for disorders that are commonly found among children that are difficult to solve. And this evening, I'm very pleased to introduce a practitioner whose work I discovered 2 years ago when I was researching for my book, Who's Crazy Here? A wonderful treatment system. And so we're going to spend this evening talking about that Brain Balance Achievement Center. Welcome, Dr. Mark Goldenberg. I'm so thrilled to have you here, actually meet you after exploring the work that you've been doing for the last 20 years. So Dr. Goldenberg is a board-certified chiropractic neurologist. He specializes in the treatment of learning disabilities, dyslexia, attention deficit disorder, and autism spectrum disorders. After graduating from New York Chiropractic College in 1985, he sought a better understanding of the complex nervous system and became a board-certified chiropractic neurologist, receiving his neurology diploma degree in 1991 from the American College of Chiropractic Neurology. A deeper understanding of the brain came from his postgraduate certification in attention deficit hyperactive disorder, learning disabilities, and neurobehavioral disorders of childhood from the Carrick Institute in 1999. As a result of his ongoing research, Dr. Goldenberg was awarded a fellowship by the American College of Functional Neurology in 2010, and he was a pioneer with Dr. Robert Melillo of the Brain Balance Achievement Centers. So you've been busy, and I hope that we can cover just a part of that in this evening.
Well, I'll do my best. That's a mouthful.
Okay. The last credit on that long list of credits that you just saw in the slide was parent. And being a parent of an autistic child gives you a special knowledge and a great deal of credibility with our audience, I'm sure. So tell us a little about your son.
Well, actually, he was not diagnosed with autism.
Okay.
However, what happened with my son is that this child is extremely bright. Mm-hmm. And what we were noticing at 10 months of age, he was talking in incredibly intelligent, high verbal types of sentences. His vocabulary was quite accelerated. Mm-hmm. For his age. Mm-hmm. We thought he was a little professor and on his way to Harvard. On the other hand, however, from a sensory perspective, socially, he would not get along with other children the way we thought should have been typical for a child his age. Mm-hmm. If he wore a shirt that didn't feel right, or he had a tag on the back of his shirt that didn't fit right, he would kind of rip the shirt off his back. Now he'd actually give you the shirt off his back. Socks that didn't fit right, low frustration tolerance, very poor coping strategies. And, we saw this kind of this imbalance. How could a child mm-hmm. be so bright from an intellectual standpoint and a concrete standpoint, but yet these other systems were just not kind of working out the way they should? So we actually talked to the school about it, and mm-hmm. we had what's known as a PPT, which is a placement and planning team meeting in the state of Connecticut. Okay. He was tested. We did a intelligence test and a academic test and the whole neuropsych evaluation. Mm-hmm. He had actually 140 verbal IQ, which is considered genius level. Yeah. His perceptual IQ, however, was 90. Now mm-hmm. that's still in the average range, but that's mm-hmm. a 50-point discrepancy mm-hmm. between verbal, or we know now, left hemispheric abilities, and perceptual, which are right hemispheric abilities. Okay. So I was sitting at the PPT, and the neuropsychologist gave me all this information, and I said, well, where in the brain is this happening, and how could we go about fixing it, and why did it happen? What's the deal here? I mean, what's happening? Uh-huh. She said, well, we don't know where in the brain it's happening, we don't know why it's happening, and there's nothing you're going to do about it. So, at that time, I did have a neurology diplomate, but I was working more with neurological injuries, traumatic brain injuries, sports injuries, mm-hmm. Things of that nature. So it didn't make sense from my standpoint. At the same time, fortuitous for me, Dr. Robert Melillo, who's a friend, colleague, and expert in this field, was doing this hemispheric work.
Okay.
Meaning that he was discovering that different parts of the brain were maturing at different rates, and he was working with children, hundreds and hundreds of children, working on this hemispheric model, looking at what side of the brain is not developing, what side of the brain is developing, and devising different ways to get that underactivated side of the brain to start processing to the level of the typical side. And now these children were becoming more social, improved attention, all of these different aspects. So I took my son to see Dr. Melillo, and that got me on the road to doing this type of work, and that's how it all came about. Now my son is a college student, he's a pre-med student, he has a girlfriend, he's doing very well. But the interesting part about this is that I have firsthand knowledge as to the inability of the school systems and doctors to actually give me answers as to what was happening.
Or how to treat it.
Or how to treat it. So I spent the last 15 years researching these different modalities on how to kind of look at these children and find the underlying cause. And this particular system, this brain balance system, was the only system that really made sense to me and gave me answers as to why these things are happening.
Well, you knew the science that underlies this, and so it's not just rational belief or sense. It's science-based, and because you know exactly what's happening and why it's happening, and now, all these years later, what to do to fix it.
That's exactly correct, Gracelyn, and that's what's lacking in the whole model today of working with these children. We're on a symptom-based program.
Right.
He's hyperactive, he's distractible,
Give
he's
him a
impulsive. Well, if he is, then we'll just give him Ritalin.
Yeah.
But as I will talk about later, we realize there is no chemical imbalance in the brain. So we have to get to the underlying cause of the issue, and once you know the underlying cause, then you could fix the problem.
And the thing that intrigued me is that because you were both chiropractic trained, you knew how to use the body to access the brain to stimulate the growth in the regions of the brain that were undeveloped.
That's absolutely correct, and that's a good point, because as a chiropractic neurologist, the trajectory of the courses we take are more functional. We take many, many, many more hours of neurology, how the nervous system works, how the function of the nervous system works, and how it relates to different symptoms and signs. So yes, by understanding and rooting ourselves in causes, what is the cause of the issue, that's how we kind of could get to more of a holistic, functional approach.
Right. You're not treating the symptom, you're not putting a Band-Aid on it, you're going for the cause, and you've developed a way to fix the problem.
That's exactly correct, because we do know that, let's take Ritalin for example. You give a child Ritalin, there are many feedback mechanisms that are in place in the brain, and when you give a child Ritalin, when you take him off Ritalin, the problem sometimes is worse, because now the brain stops producing dopamine, which is the neurotransmitter that Ritalin increases in the brain. So there are so many feedback mechanisms that go awry.
So the brain is adapted to the medication, and so it can't produce the dopamine on its own then.
You got it.
Okay. Well, let's explain what the Brain Balance Program really entails, what it's about.
The Brain Balance Program is a specialized educational program, and we deal with children struggling with attention, academics, behavior, socialization, based on an imbalance in the way that the brain is developing.
I think there's the slide on it. Okay.
Okay, yeah, that's fine. We call that a hemispheric imbalance. So what's happening basically is that one side of the brain is maturing at a much faster, stronger rate than the other side of the brain, and they can't connect. They can't communicate together. So through a very comprehensive assessment over 3 days, we look at all the different functional systems in the brain. We look at sensory systems, motor systems, cognitive systems, academic systems. We look at dietary, metabolic systems to see these imbalances. And once we see these imbalances, we're able to now pinpoint where the deficits are and start correcting them, so now the child's functionally capable of learning and better able to utilize their brain more efficiently. Okay.
Share some of the numbers about, because people ask me, you know, these disorders in children are becoming epidemic. So talk about that a little bit.
Well, that's true, and I think that's an important thing to realize, is that these disorders are becoming epidemic in nature. When you look at the statistics in terms of what's been happening over the last 20, 30 years, we realize that in the 1970s, for example, 150,000 children were diagnosed with attention deficit disorder, or were on methylphenidate or Ritalin. Now you look at the number today, 4 million children a year are taking stimulant medication for attention deficit disorder. That's astounding.
And at a very young age often.
Oh, this could start at 2 years old.
Yeah.
2 to 3 years old, when the brain is just forming. And it could cause dramatic changes in brain development when you start introducing these chemicals.
And these drugs were never tested in children.
Actually, that's true. A lot of these drugs that were given to children are off-label medications. For example, I'll just divert from ADD, for example. You talk about bipolar disorder, which really the jury is out on if bipolar is actually a true diagnosis in children. But one of the mainstays of bipolar disorder pharmacological medication is Lamictal, Trileptal, Depakote. These are anti-seizure medications. Okay? So when they were put up to the FDA for approval, they were put up for approval based on their ability to control seizures, epilepsy. But unfortunately, the way our system is structured here in the United States, as long as a medical doctor feels a medication could help another symptom, they have the green light to go ahead and use it. Now, one of the mainstays of working with bipolar disorder is giving children anti-epileptic medication. However, it's never been tested, and it's never been approved.
And they don't even know yet, really, if children can be diagnosed with bipolar that young, because it's pretty dicey.
That's correct. Now, again, you have a school of thought that says yes, a school of thought that says no. But you know what? And this is the difference between our approach and the current antiquated model, is that we don't work with symptoms. We work with functional, objective findings. So it doesn't really matter what you call it. You could call it ADD, you could call it autism, you could call it dyslexia, you could call it bipolar disorder. It doesn't matter what you call it. What you need to do is look at the different aspects of the brain, the different musicians in the orchestra, so to speak. See where these systems are not maturing and functioning correctly, and then go about stimulating them so that the whole brain could mature appropriately, grow, and the child could be successful in many, many, many different ways. So
we have some other numbers on the astonishing rise in these disorders, I think, the increased prevalence.
Right. So, you know, we talk about the CDC came out in 2007.
I think we need the next slide.
And the increased prevalence. So what we see is, if you add all these numbers up, 10% of our childhood population will be diagnosed with attention deficit disorder. Another 15% of our children will be diagnosed with a learning disability or dyslexia. 1 to 2% of our childhood population will be diagnosed with an autism spectrum disorder. That totals 25%. That's astonishing. That's 1 in 4 children will be diagnosed with some form of neurodevelopmental disorder. Now, if that's not an epidemic, I don't know what is, because if you look in history, the polio epidemic was considered an epidemic when 1 in 2,700 people had polio. This is 1 in 4. Oh. So this is a true epidemic. And when you look at all the other statistics in autism, for example, in 1990, 1 in 10,000 children were diagnosed with autism. That number went to 1 in 150. The CDC just published a new statistic. 1 in 88 children now will be diagnosed with an autism spectrum disorder. If you look at certain other studies, the Korean study, which was a conglomeration of the United States, Canada, and Korea, 1 in 38 children will have an autism spectrum disorder.
So what's driving this epidemic? Because it's so rapid. I mean, what is causing this to appear so quickly and change and morph so quickly?
That's the million-dollar question. And what we're seeing now, Gracelyn, is that the current theory is epigenetics.
Okay, say what that means.
Okay, so right. So, and it's important to say what it means because, you know, science is looking for this gene, this smoking gun, this one gene that's causing autism. Where's the gene? Let's put billions and billions of dollars into this research to find the gene that causes autism. They can't find it because it's not there. It's a combination of genes and the environment. Now, the environment can actually change the way genes express themselves. So if you think of...
Which means turn on or turn off.
That's exactly correct.
Right.
So the way I like to describe it is that if you could think, genes are found along what we call a chromosome. Okay? So if you could think of a piano, the
Right.
piano is the chromosome, but the keyboard are the genes. Now, excuse me, depending on how you play the keys and the timing of the keys and which keys are played at the right time, you could have millions and millions of different songs just based on how you play the keys. And that's what genes are. Genes get turned on and turned off at very specific times in development. If these genes are not turned on and off at very, very precise times, it alters the whole landscape and architecture of brain development and body development. So epigenetics, through, let's say, a number of risk factors, maternal stress has been shown to be a huge risk factor in estrogen and androgen levels being awry in the fetus. Toxic chemicals in our environment, infectious microbes. So many different environmental factors have changed over the last 50 years that it's actually causing certain chemicals are being latched onto our genes and preventing them from being expressed.
Turning on when they need to, and that's really important during the different time frames of a child's growth and development.
Absolutely it is, and there is a slide that we have showing a pyramid of that, but the...
Okay, so that's probably many problems here. How does turning a gene on or off impact everything? All right, we'll
so
go to
that's
that
it.
slide.
Slide.
Many problems slide.
So
there we are.
So that's correct. So what you said is 100% accurate. When these genes are not being turned on and off at the right time, which leads to the brain becoming out of balance, what happens is, what does the brain do? The brain's responsible for us taking in information, movement, thought, cognition, attention, socialization. The brain even controls our immune system. So when these genes are not turned on and off appropriately, you're going to have a myriad of different types of symptoms. You're going to have motor symptoms, where these children have fine or gross motor weaknesses, meaning poor posture, weak.
Or they're clumsy.
Or they're clumsy,
Right.
or they have poor spatial orientation, or depth perception,
They run
or
into
disorientation. They run into things because they don't know where their body is in space. Or they could have fine motor difficulties, meaning handwriting, buttoning, zippering. Dyspraxia is the medical term for a child who can't really use their hands appropriately. Visual spatial problems, again, like you mentioned, clumsy, disoriented, space perception difficulties.
So these kids would not be good athletes, and they would have problems with some basic functions, just tying a shoe.
Absolutely.
Okay.
Now, parents say to me, I say to parents, does your son like sports? No, he hates sports. Well, that's not true. No child hates sports. The reason a child does not gravitate towards sports is because they see that it's uncomfortable for them to be on a field and know where this child has to be, where do I have to be, what are the rules of the game, what comes next. All that involves a perfectly functioning, timed brain. But when the brain is out of balance, that's not happening. So it goes into so many different systems, social systems, cognitive systems, immune systems, sensory systems.
And that's why it's important to catch it young, before the brain, they go through more and more brain development, because everything gets even more off kilter if you don't catch it quickly enough and start working on it.
You hit the nail on the head, and we call those growth phases. Now, the
Okay.
brain goes through growth phases every 12 to 18 months. But what's important to realize here is that if you have one side of the brain that's developing at a higher level than the other, and that brain goes through a growth phase, the higher level neurons will form together, the lower level neurons will communicate together, but you won't get too much cross connection. What we want to do is get that underactivated hemisphere up to the level of the typical hemisphere, so now when the child goes through growth phases, both hemispheres connect, and now the child's able to be more functionally capable of processing information.
So there's no chemical imbalance?
Unfortunately, and I hate to say this because a lot of doctors and people out there, you would think there's a chemical imbalance based on all the medicine we're giving our children, but if you look in the research, and I do this quite often, almost every day, you would be hard-pressed to find any study to show that there's a chemical imbalance in the brain. So I'm just going to give you a couple of different quotes from various articles that are out there, and these aren't, fringe articles. These aren't fringe journals. This is from the American Psychiatric Association textbook of neuropsychiatry. Okay? Mm-hmm. Efforts to identify a neurochemical imbalance in ADHD children have been disappointing. Jensen, who was the head of this, the largest ADHD study called the Multimodal Treatment Study on ADHD, after a 3-year follow-up, said medication use was a significant marker not of benefit, but of deterioration. The long-term efficacy of stimulant medication has not been demonstrated for any domain of child functioning. That again is from that study. And as far as SSRIs go, research into the SSRI use in childhood depression is one of confusion, manipulation, and institutional failure. This is the Lancet. Okay, this is one of the most prestigious medical journals in the world in 2004. Mm-hmm. So we know that there's no chemical imbalance. It's a connectivity imbalance.
So what is the actual problem?
The actual problem is the fact that the brain is not communicating and developing appropriately. Mm-hmm. So again, we call this a functional disconnection syndrome. And the way to really look at this is if you took two computers, let's say, mm-hmm. you have a really fast processing computer, like a dual core processing computer, and you try to put it together with an older DOS-based computer, very slow processor.
Right.
You can put all the wires together, but they can't share information because they're processing at different speeds. And that's really what we're seeing in our kids. So what separates the human brain from all other brains is we have this ability to take all these separate parts and different parts of our brain and have them all fire and wire together at the same time. So imagine the brain as a beautiful orchestra of 100 musicians, let's say. Mm-hmm. You have 30 of these musicians that are playing at the wrong speed, the wrong time, the wrong tempo. Their instruments aren't tuned correctly. Well, how's that music going to sound? That music's going to sound horrible. So you have to look at the musicians, identify where these musicians are not able to play correctly, and now start working with them individually, but then you have to integrate them back into the orchestra, and now the music sounds beautiful. And that's what the brain balance program is all about. So the underlying cause and the real cause of this is a functional disconnection syndrome, that if you took an MRI on the brain, it would be normal. So there's nothing broken in these kids' brains. Mm-hmm. There are just weak neuronal systems.
Tell us about the cognitive stages of this development. What happens when?
Well, this is very important, and this is really the key to why children develop imbalances in the brain. Because if you realize what's happening in the brain starts to develop in utero, obviously, in mom's belly.
Right.
There are very specific time frames that the brain has to go through certain stages in order for a typical brain to develop. Now, the first stage of brain development is known as primitive reflexes. These reflexes are survival reflexes. These have been inbred into our through evolution into our brain. Mm-hmm. These set the stage for brain development and allow the child to survive the first year of life, but they start in the womb. Now, what happens is that these reflexes help the baby be born, and then they start sprouting connections. So these reflexes allow the baby to see, feel, taste, touch, smell, move around their environment. Those primitive reflexes give rise to higher level sensory and motor systems, which then give rise to higher level cognitive, emotional, instructional, behavioral, attentional systems.
It's building.
It's building. However, these higher level systems, once they start getting established, reach down to those primitive reflexes and say, okay, you did your job, we don't need you anymore. So it's time to shut you down. That happens at 1 year of life.
Wow.
So a child should not have any primitive reflexes after a year. But if you don't check these things, you're not going to know whether a child has primitive reflexes or doesn't. Now, many of the children we check, and this is part of our comprehensive assessment, we check and evaluate primitive reflexes. Mm-hmm. And these children, a lot of them have anywhere from 2 to 8 primitive reflexes. So it puts the brain on a holding pattern and doesn't allow the brain to develop. So through our program, we give reflex inhibition exercises to inhibit these reflexes to allow these higher level systems to develop more efficiently through our proprietary work that we do at Brain Balance.
So it's all done through physical exercises, and I understand that you use some supplements too, natural supplements, to make sure. But we'll talk about that a little bit later. Okay, so so according to your book, this wonderful book, Disconnected Kids, this is the one that I read, and this is by Dr. Robert Milillo.
Yes.
And you diagnose a child's problems asking 2,000 different questions. And so this is over the 3-day thing, and this indicates what's awry in the brain.
As part of our comprehensive assessment, we ask the parent over 2,000 questions.
Okay.
However, it's important to realize that that's not the whole sole way we look at a child and determine the hemispheric imbalance and where the immaturities are.
Okay.
This gives us a lot of information from a parent's perspective, which is important to know.
Yes.
But really, the answers we get are from our functional, physical, and cognitive assessment. That gives us objective, functional, neurological evidence of where the weaknesses are.
Okay.
So it's a combination, yes, of asking the parent a myriad of different questions in a lot of different ways, plus doing our proprietary assessment, where we look at sensory systems, motor systems, cognitive, academic systems. I put everything together and come up with where the imbalances are, at what age level or developmental level this child is actually functioning at. You could have a 15-year-old child that's at a 5-year-old level in basic optokinetic reflexes or certain functioning. So that's what the physical objective test gives us. But yes, we do ask a lot of questions, but it all comes together in one specific aspect of where the brain is not developing.
They're questions with a very specific intent to learn minutia, and that's important.
Yes, and we take all of those questions and we ask them in different ways, because a parent might answer a question in one way, but then if you ask it again in a different way, they'll answer it in a different way. So it's not like the typical 10-question checklist, 20-question checklist, and then you come up with a diagnosis.
Okay, well, we have a slide about the left brain, right brain functioning that has just shows a few of the areas that you're checking. So discuss that slide a little bit.
Okay, what I want to do first is just give a general idea of the left and right hemisphere.
Okay.
So when you think about the left hemisphere of the brain is the concrete, logical, black and white, detail-oriented hemisphere. We call the left hemisphere the gas pedal of the brain. Why? Because the left hemisphere is all about intention. I want to do this. I have to do this. I have to say this. I can't stop thinking about this. The impulsive, obsessive part of the brain.
Okay.
The right hemisphere is more of what we call the brake of the brain. Well, maybe it's not the right time to say this. Maybe we shouldn't do this right now. Maybe we should keep our hands down and wait till the teacher asks a question before we just blurt out the answer. The right brain is the social part of the brain that picks up nonverbal intelligence, looking at people's body language, eye contact, inflections in voice. It's called nonverbal intelligence because you're picking these things up without hearing, without being told.
It's the senses are picking all of this up.
The senses are picking it up unconsciously.
Right.
That's the right brain, the sensory-driven part of the brain, the emotional part of the brain.
The intuitive part of the brain.
The intuitive part of the brain. We call the right brain the EQ, the emotional quotient.
Okay.
The left brain is in charge of the IQ,
okay,
the intelligence quotient. But you have to have both together. For example, a child with a right brain deficit might be an excellent decoder, a great reader, and he'll read and read and read, and you'll ask him, well, what do you think the main character was thinking when he did this or when he said this? He'll recite back to you exactly what he read. But you're asking him to now form an inference.
Integrate.
Integrate. Yeah. Cause and effect thinking, drawing conclusions. That's the right brain. The left brain is logical, memorization, rote memory. Rain Man, which was an excellent movie,
yes,
was about an autistic savant, which is pretty much the strongest level of functional disconnection you can have. An extremely high-level left brain could memorize thousands and thousands and thousands of facts and figures and events from 50 years ago. This person, Dustin Hoffman, in Rain Man was able to tell you, your birthday or some person's batting average from 30 years ago.
Right.
But you ask the same person, what do you want to do tonight? What do you feel like doing?
Feel.
I feel fine. I feel warm.
Right.
That's the right brain.
Right.
So we can, go down the whole list, but it's really, you need both hemispheres to function in a coordinated fashion for the child now to be successful and be happy and healthy and less frustrated.
So cover some of the basic things that you address in the right hemisphere and some of those in the left hemisphere, to just give more concrete examples of what you're talking about. Some of these that you have on the slide.
Okay, could you put that slide up? Okay, so for example, the left brain is all about verbal communication. The left brain is the part of the brain that is able to use the small muscles of the oral cavity to speak, reading and decoding, specifically the small little symbols of letters and how to string them together for a word, whereas the right brain is more comprehension.
Okay.
So the left brain reads the word, the right brain comprehends the word.
Okay.
The left brain is more about mathematical calculation, numerical operations, addition, subtraction, multiplication, whereas the right brain is more about math reasoning skills.
Right.
The left brain is about, again, I said the gas pedal. The right brain is the brake. Left brain is about details and facts. Right brain is about more gestalt processing, getting the big picture of something, not just seeing the trees, but seeing the whole forest. The right brain sees the forest, the left brain sees the trees. The left brain loves sameness and routine.
Right.
Has to have the same thing happen over and over and over again. But the right brain loves novel learning.
I have to laugh because while you're describing children, I'm through this whole process, my husband is very left-brained and I'm very right-brained, and I think together we're a better whole than we are separately.
That's right. The whole is bigger than the sum of the parts.
But both of us actually use both hemispheres of our brain, but one is very dominant, and that's the intriguing part. But here we're talking about one that's not functional.
That's a good point you bring up, because everyone has a stronger hemisphere and a weaker hemisphere. Everyone is either more left brain dominant, more right brain dominant, but you could still interact with people. You still function in society. You still are successful. That's okay, because that's the way people are. I mean, no one's perfect.
Well, that's how we choose different careers. You know, an engineer versus a salesperson.
Absolutely, and we meet our mate. And just like you said, your husband is left brain, you're right brain, so you kind of work together. I'm talking about a situation where it's no longer a typical imbalance. It's now interfering with the child's life from an emotional standpoint, and development from an emotional standpoint, a social standpoint. This child now is unable to do well in school. He's failing out of classes, or he can't make friends, very emotionally reactive. I mean, now we're getting into beyond the typical aspects of a typical imbalance.
Yes. And I think you had a quote from an international journal on a slide that we wanted to talk about.
Well, this is very interesting, because actually we did our first outcome study in the International Journal of Adolescent Medicine and Health. And what we did is we took 120 children that were documented ADHD through their physicians. We put them through our program, and this was a 12-week program. At the end of the program, we used the Brown's ADD scale. The Brown's ADD scale is a scale that's typically used in physicians' offices and psychologists' offices. It's a checklist, basically, and it's used to diagnose ADD or inattentive or hyperactive types of attention deficit disorder. So what we did is we had these children who were positive on the Brown scale before we did our work, and then we redid the Brown scale. 82% of the children who showed attention deficit disorder on the Brown scale, after going through 12 weeks of our program, 82% no longer met the criteria for ADHD after going through our program.
That's amazing.
That's without medication.
That's without any medication, and that's without any need to continue treatment thereafter, or do they still have to continue doing some exercises?
Well, the way our program works is that once we finish with a child, and when I say finish, they have attained the levels and attained the made the gains we set out for them, the goals we set out for them.
Okay.
Once we do that, we still need to have this child do certain stimulatory activities at home, because they are going through growth phases. So we want to stimulate them appropriately. So their diet is in place. We've made life changes in terms of their diet, in terms of their behavior. There are exercises they continue to do at home to maintain the gains we've made with them.
Okay.
And then we see them back in the center 12 months later, 2 years later. And my longitudinal studies have shown that children who come back 12 months later are actually doing better than when they finished. Because
so
we're giving him, go ahead.
The brain is building.
That's exactly correct. So we're giving the child access to parts of their brain they're not able to access now. And once they access these pathways, they perpetuate themselves.
Okay. And so tell me, we've come to how the outcome is, but tell me how it begins, how the treatment begins, where it all starts.
Everything starts with the assessment.
Okay.
So, as we said very early on in this conversation, people aren't getting answers. They're getting diagnoses. They're talking to their doctor for 2 minutes and saying, my son is impulsive, hyperactive, he can't socialize. Boom, there goes the diagnosis.
Mm-hmm.
So the assessment is all about giving a parent answers. So it's a 3-day process.
Okay.
And what we do...
We have a slide on that?
There should be a slide that shows...
it all starts with?
It all starts with the assessment.
Okay.
But what we do is on day 1, we do a very comprehensive sensory motor assessment. So we look at over 650 different functions of this child's sensory motor system. How their eyes are moving, how they perceive visual information, what type of reflexes in the oculomotor system are they revealing, how they are processing auditory information, their fine motor system, timing in the brain, balance, coordination, movement, all of these different sensory motor functions. The next time a child comes in, we do a neuroacademic test with over 290 functions. So we're looking at them from a cognitive standpoint.
Okay.
And then we put all this together and look at imbalances in cognitive academic function, imbalances in sensory motor function, and this gives us a very, very strong indicator of, number one, if the child has an imbalance, how severe that imbalance is, and how long it's going to take us to work with that child to correct that imbalance. But the beauty is that there's nothing broken in these children's brains. So if you stimulate these children appropriately through these different modalities, the nerves could actually grow and improve, which we're going to see later in a slide when we talk about neuroplasticity. We're actually going to see what these nerves look like, a weakened nerve, so to speak, and then a strong nerve.
I think I skipped that slide, so let's go back to that.
You did? Okay.
I'm sorry. Neuroplasticity, because this was really one of the things that I found so fascinating is that it takes a certain amount of time for the brain to sprout new neurons from certain stimulation, and then you have to continue that for at least almost 40 days, I believe, according to the research, to have that those changes become more or less permanent and then keep growing.
That's exactly correct. So if you look at neuroplasticity, this has been well documented in science for over 30 years. Neuroplasticity requires the exact stimuli to be applied. It has to be delivered in an appropriate sequence. The timing has to be very precise when you deliver these stimuli. These stimuli have to be delivered and combined in a very specific way, has to be repetitive over a 3 to 6 month period of time, actually, when you're dealing with imbalance. Now, you might be speaking of maybe just changing a habit or something like that, learning something, which is 40 days, but we're really talking about changing a whole hemisphere of the brain, which is really about 3 to 6 months. Now, this is Michael Merzenich work. I mean, he's the grandfather of neuroplasticity. He's a professor of neuroscience at the University of California in San Francisco. But this is what the Brain Balance Program is all about, the whole concept of neuroplasticity. Medication does not evoke neuroplasticity.
And neuroplasticity, define that term a little bit.
Neuroplasticity is the ability of the brain to change and grow with appropriate stimulation. When you look at a neuron or a nerve, it's like a muscle. So how do you make a muscle grow? You resist gravity. Okay?
You use it.
You use it, that's right. So you're resisting gravity. Now what happens? You don't grow more muscle cells. That muscle increases protein and the muscle gets bigger. Now the next slide we're going to see is an actual slide of the neuron. There are 2 neurons. If you could imagine the neuron, the weak neuron, a neuron is like a tree. So you could have a very healthy, lush tree with very thick branches, a lot of branches, that would be the healthy nerve, and a lot of thick roots that are coming out. Or you could have a very weak tree that's underdeveloped, maybe not getting a lot of water, not getting a lot of sunlight. That tree will have very few branches and very few roots. Well, it's the same with the nervous system. If you look at the weak neuron and weak nerve, you see that nerve can't receive too much information. The healthy nerve could receive a lot of information from a lot of different places.
Because it connects to a lot of other places.
That's right. You go down the tree and you see the roots. Those roots could now spread out and connect to other neurons, whereas the weak nerve cannot connect to too many neurons. But the other important thing to realize is these two neurons you see on the screen can't connect with each other because they're oscillating and processing at different speeds, so they don't connect.
So the weak ones can't connect with the strong ones.
That's right, and that's the problem in children, is that if you leave this imbalance without correcting it, this child is now going to continue to grow without having the availability of both hemispheres of their brain to really communicate and share information.
Well, and the thing that I found encouraging is that this neuron growth and neuroplasticity means that the brain can grow and develop at any age.
It's absolutely correct.
So if you have brain damage, lots of times the brain can compensate and grow if it receives the right stimulation. And in adults that have strokes, sometimes they are able to recover, sometimes not, depends on the depth of damage.
Exactly what I was going to bring up, stroke. That's
Okay.
a perfect example of it. In stroke, obviously, is different than in the work we're doing, because when you talk about stroke, you're talking about neuronal death.
Okay.
It's not really weakened neurons.
They're gone.
These
They're
neurons
dead.
are gone. But through plasticity, what happens is the surrounding neurons tend to grow into that area of neuronal death and now take over.
And the brain compensates.
And the brain compensates and now uses those new neuron sprouts to restructure the architecture of the brain to do what those other neurons that were dead, it takes over the job of those other neurons.
Well, I read a wonderful book that I unfortunately can't remember the name of right now, but it was about brain. A lot of people that were born with half a brain, and yet their brain compensated, and they were able to, it took a lot of work, but they were able to learn and develop and have lives. And so the science of neuroplasticity has brought us a lot of knowledge in the last few years that we thought, if you didn't have it to begin with, it just was impossible.
You're 100% correct. And when we look at somebody like Albert Einstein, let's say, Albert Einstein was considered mentally retarded when he was younger.
I didn't know that.
He didn't speak till the age of 7. He failed out of public school. They thought he was actually mentally retarded. He ended up writing the theory of relativity, which is the greatest piece of scientific literature ever written. So when Albert Einstein died in 1955 at Princeton Hospital, they actually took slices of his brain to see what is this? What's in the brain of this gentleman that caused him to have such an incredible ability to process information. What they found was he didn't have more nerve cells than anyone else. He had more connections. He had more branches than other people. So what you're saying is correct in that it's not about the amount of nerve cells. Pretty much everyone has the same amount of nerve cells, but it's the branches. It's the way these branches connect and communicate, and the amount of synapses, we call them, where two nerves come together is called a synapse. It's the amount of these connections that determine whether a person processes at a very fast, efficient, incredible rate or a slower rate. So that was, Albert Einstein was a very good example of neuroplasticity. And he used to play the violin whenever he thought about something, which actually helped his left brain because high frequency noise and sound stimulates the left hemisphere.
Okay, so let's go. We have one other slide, how the outcome of the brain balance centers is versus other providers. And that's our last slide. There we are.
So this is an interesting slide, and the reason I put this together is to just show parents and individuals the current model of what's happening out there today and what we offer children, which is quite a bit different. The current model, and I did it myself as a parent, is, well, we'll go to the speech therapist, and then a month later we'll go to the developmental optometrist, and then maybe we'll go to the occupational therapist, and then maybe we'll go to the physical therapist, and I think we should go to the nutritionist, and then we should go to the
exhausting.
It's exhausting. You say it's exhausting to even hear it and even say it. Could you imagine a parent for years getting in the car and taking this child to all these different practitioners?
Well, and also the cost of all of that is unsustainable. I mean, the parents that I know who have autistic diagnosed children, finances is a real issue because it's such a costly disease to treat.
You're getting into the from 50 to 100, 150, $200,000. I mean, even more. I mean,
Yeah.
it's just unbelievable. So, what we see in Brain Balance, which is all the checks lined up in a row, we realize that all of these different things have to be done together. Because the brain doesn't first see something, then feel something, then say something. It has to have it all done at the same time. And that's why at Brain Balance we do oculomotor activity, auditory processing activity, balance, coordination, cognitive, holistic, dietary work, all of these things at the same time so that the brain could fire and wire together more efficiently. And this is how the brain sustains itself and is able to continue to grow and improve as the child gets older and older.
We just have a few more minutes, but I wanted to ask you to talk about the new book, Autism. I haven't had a chance to read it yet, so I would hope you can tell me a little bit and tell the viewers a little bit about, summarize what's in here and why they'd want to look at this as well as the Disconnected Kids book.
Absolutely. Dr. Melillo really is incredible. I mean, he just came out with this book, Autism. And this book is quite unique in the respect that it covers so many different areas and answers so many questions as to what parents really want to know about autism. This book covers not only why are we getting these epidemic rises in autism, increased prevalence, increased incidence. He goes through the whole aspect of, is this really an increase in autism or is it just that we're better diagnosing these? He goes through many, many studies and statistics to show that it's actually a real rise in these conditions. Dr. Melillo goes through what's happening in the brain of an autistic child. So when we talk about autism, we say, oh yes, autism is a problem with communication, language, socialization, repetitive behaviors, stereotypical behaviors, obsessive types of routines. Those are symptoms. What Dr. Melillo goes into is what's happening in the autistic brain. What are the problems that we see in an autistic brain and why children manifest with autistic symptoms, but from a functional standpoint, actually what's happening.
Okay.
Then he goes into risk factors. What are the risk factors in couples who want to have a child? How could they actually do certain things right now to prevent them from having an autistic child? So again, it's genes partially, but it's also the environment.
Well, it's also the level of toxins that the parents are carrying, and I'm going to have a naturopathic doctor talk about that in one of these segments.
Excellent.
What to do if you're preparing to have a child, so that you're not passing on all of the toxic substances that we all carry now as adults.
That's right, and that's the part of epigenetics. You can pass it on.
Yes, you do pass some of it on, and it impacts sperm rates and all sorts of things. So we will cover that, but I think I'm thrilled for this book. I look forward to reading it.
It's a really great book. I do want to just add one thing, is that I do give these types of lectures in my center from time to time.
I know, I came to
one.
one.
Yeah, you came to
you.
one, that's right. So I don't know if this Wednesday, March 21st, but I don't think this might even air after that, so I'm not sure.
Yes, this will air in April
or
May.
But just so, we do give lectures from time to time, talking to parents as to why these disorders are occurring at epidemic proportions, what's going on in the brain, and how we could help improve these children on a long-term basis.
And if they want to get on your mailing list, they can go to your website, which I think has been running on the screen off and on as we speak.
They could go to brainbalancenorwalk.com or they can go to brainbalancecenters.com.
Okay.
So both of those will take them to the right place.
Okay, great. Thank you so much. It's just been a thrill to talk to you and have you appear here and help so many people through your knowledge and through your Brain Balance Achievement Centers. I'm really very grateful for your work.
I'm grateful that you had me, and I always enjoy talking about it, and it's been a pleasure.
Thank you. Please tune in on next Tuesday night at 9 o'clock for another episode of Restoring Kids' Health Holistically. For a listing of the topics and dates on which they'll air, please go to my website, crazyrecovery.com. Thank you and good night.